So let me begin today's lecture. So it's the part 3 of the instruments thing, a very important topic again. This particular thing is asked to you throughout your dentistry. It is asked in your final year, it is asked in your second year, and it is asked in the PGs also, PG level also. So the thing is, what is we have to see now, how did the rotary instrument evolve? So the first thing was that rotary instruments have always been there in the normal world. But when it came to dentistry before 1728 and all, we were not using rotary instruments. We were using only the hand instruments, which I told you of, and that was helping us to remove the infection. If you can understand, you will know that removing the tooth structure with the small strokes of so rotary instruments came into existence, and we actually started aping the other specialities from where the rotary instruments started were used, like in the industry and all those places. So a very crude instrument was made, and it had a RPM only about 300. 300 RPM means rotations per minute. So as I told you, अगर आपके पास वो दाल घोलने का या हम छाछ जिससे बनाते जो रवि है, अगर हम उसकी मूवमेंट करेंगे, so 300 times if you move it in a minute, it becomes 300 RPM. So now you realize that the RPM was very less. And the same thing today we are doing in a mixer or a electrically operated instrument. So the RPM of that is so much easier. Also, there is no strain on your hand. So slowly we evolved into a better instrument, which was called as a drill ring. So here the advantage was that it was looping onto your finger so that you could balance it better, but still you had to move it with your fingers. So in 1850, a straight handrail which gets converted into a angled handrail. See, the first picture was straight handrail, isn't it? So going into your molar, if you have to do a proximal cavity, it is very, very difficult. You needed something which had an angle in the front. So in 1850, the drill got the angles, and that is how it helped you. Okay. Then in 1871, the foot engine came. We had a sewing machine. All our mothers, your mothers, and your grandmothers will have that sewing machine, which they used to pedal with their feet so that the needle moved. The same thing was used in dentistry. And this particular thing, it was in existence in the government dental college Nagpur also. We were a little better batch, so we got foot control, of course, but we didn't have to mechanically move the foot control. So then by 1874 electric engines started coming in, and all your senior staff like me and sir and all, we have used this electric machine with only 1000 rpm. Okay. So in 1914, the first dental unit was introduced with a RPM of 5000. This incorporated an electric motor inside the unit and used stainless steel bulbs. So as we as we started evolving, we started having better and better instruments to do the cutting, because without cutting, without cavity preparation, without the box preparation, it was not possible for us to do the good restoration. But all this with 5000 rpm and a stainless steel burr, what was happening is you needed excessive pressure to cut. and the procedure resulted in increased heat generation. If where else you see heat generation? If you have used in prosto or in our department also, when you're doing your pre-clinics, the burr, if you're using a diamond burr, the heat generated is less. But if you use a stainless steel burr, the heat generated is more. That is because a stainless steel burr is not so sharp to cut the tooth. Remember, always remember this one thing, that the enamel is the hardest structure uh, present on the earth. It's the hardest structure present on the earth. So if you want to cut a stone which is that hard, you require an instrument which is sharper than that what you say, material, isn't it? So steel, if you can imagine, steel will bend, it will not cut enough. So in enamel, which was normal, hard, was very difficult for us to cut with steel. So diamond is again a very strong material, and it is considered to be a just shade uh, less hard than enamel. So a diamond point could easily cut all your tooth structure, especially the infected tooth structure. So we started in 1942. The love story of dentistry started, and we developed diamond cutting instrument. Today, dentistry is not possible without a diamond cutting instrument present in your armamentarium. So in 1947, there was another burr which came, which was called as the tungsten carbide burr. This also had very good strength, and it could cut the tooth structure and give you a speed of 50,000 RPM as well. But the thing with tungsten carbide burr is they break easily. So that was a major disadvantage. And so in 1950, ball bearing handpieces were introduced. So earlier the handpieces just had a pulley in it, like a rope. है ना? हमने चरखा देखा है, चरखा में the pulley is moved by a rope. Similar thing was there in the handpiece also. We have used those kind of handpieces. But then we got a ball bearing handpiece. So everything started moving on the friction was less, and it started moving by a bearing. So the first water turbine angle handpiece was introduced in 1955. See, it's not very any old that we are using the air rotor. So it came only in 1955, and it provided you a 50,000 RPM high speed, and since it was moving only on friction, there was no pulley, there was no pressure needed to cut. In fact, if you applied pressure, then the burr used to stop. In 1957, air turbine contra-angle handpieces operating at a speed of 250,000 RPM was developed. Okay, so this type of handpieces gave you a better speed. The unit was more compact, and you could do cutting efficiently. Very earlier, one class 1 cavity they used to cut for 1 week. Then it came to 2 days. Then it came to few hours. And today with air rotor and all, it takes few minutes. So that is how it has evolved. And today we have the most popular cutting device, which is simple, easy to control, and we can do any type of treatment with this. Dentistry is not possible without the air rotor handpiece. Today in the COVID world, since our air rotor handpiece generates a lot of aerosol, the dentists are having problems because they are saying कि we cannot have any procedure to be done which will generate aerosol. Aerosol is the powder which gets moved in the environment surrounding your working area. And if it is contaminated with this COVID virus, it will spread in your dental operatory, and it will remain and keep it infected for a long period of time. So right now, most of the dentists and all dentists are doing dentistry without a air rotor handpiece. They are just giving emergency treatment relief to the patients, because we know dentistry is not possible without air rotor. Air rotor is banned by the government right now, so we can do only this much. Okay, so improvement in the air turbine handpiece. What was happening is this head of the handpiece earlier was very big. I remember during my PG days, if I was cutting the cavity, the head was so big that I couldn't see where I was cutting, and the torque was less, so that smoothness, that cutting the tooth like butter was not there. The noise levels were higher, and the chucking mechanism, chuck is when you put the burr into the micromotor handpiece, there is a latch there, isn't it? That chuck is called as a latch type of chuck. For an air rotor handpiece, it is only friction grip. And nowadays we have lights on the head of the handpiece so that you can directly see into the cavity. So this head has become smaller, the torque is better, the noise level has come down, and the chucking mechanism is also better. Coming to the classification of the rotary instruments, they are classified according to the speed, usage, and the holding device. Okay, so here, if you look at the classification which was given by Charbonneau and which was based on the rotation speed, you had the conventional or low speed where the RPM was less than 10,000. You have increased or high speed, that is 10,000 to 1,50,000. This is the speed at which you are using the micromotor. And in the clinics and the postgraduates are using ultra speed, where they are using a air turbine, air rotors with a speed of more than 1,50,000 RPM. It is again divided into three types. That is the cutting instrument, the abrading instruments, and the polishing instruments. The cutting instruments are one which will cut the tooth. You all have cut your cake, isn't it? So when you cut the cake, what you do? You take a knife and move the knife from the top of the cake to the bottom of the cake. So you get a clean cut. That is called as cutting. So when you cut the tooth, it is called as a cutting instrument, and you have the stainless steel burrs and the tungsten carbide burrs here. Abrading instrument. Have you eaten ice cream or tried to scoop out of ice cream out of an ice cream carton? What you do, you have an instrument with which you try to scrape the ice cream from the box. So you are scraping it off. You cannot cut a ice cream, isn't it? When it becomes soft, you can, but otherwise you will have to abrade it with a spoon and take out flakes. So that is called as abrasion. So the abrasion is of the tooth is possible with diamond points, carborundum disc, which are coated with aluminum oxide, garnet, sand, cuttle, emery, or diamond. And the last are the polishing instruments. So if you have brassware at your home, we all polish our brass at home with a powder. The powder is called as क्या powder use करते कि नहीं घर पे? Pitambari. We put that powder, and with a cloth or a dry polishing cloth, you try to move it around the surface so that it starts sparkling. So that powder is a polishing powder. The instrument is your cloth there. Agreed? So these are the three different ways you do the cutting of the instrument. Now coming to the Description of the cutting instrument. The term rotary cutting instrument refers to a group of instruments that turn on the axis to perform cutting, abrading, finishing or polishing of the tooth structure or a restoration. You all have used a micromotor by now. You all know that the burr tip rotates, isn't it? It rotates on one axis. So, and with that rotary motion of the burr, you are either abrading or you are finishing or polishing the tooth structure, or you are doing the same thing for the restoration. The actual device for cutting may be of two types. You may have the hand pieces, or it is not of two types. The actual device has two parts, that is the handpiece and the burr or the abrasive parts. Coming to the handpiece. Handpiece is a device that holds and transmits the power to the rotating instrument. The part which you are holding in your hand is the handpiece, and the handpiece is just transmitting the power from your micromotor to the tip of the burr. Other than that, it is not doing anything, and this helps you to position and control the instrument in the mouth. Okay, so you have two types. You have a straight handpiece and you have a contra angle handpiece. So coming to the straight handpiece, see, this is a straight handpiece. This is the handle of the handpiece which you will hold, and see the burr, and the burr will be here at the tip. So when you're cutting, the burr can cut only straight, isn't it? So this handpiece is more used in the lab or occasionally in the oral surgery department, where they have to cut the bone. They don't have to really cut the proximal surface of the tooth, the mesial surface, distal surface. So there it is indicated. Other than that, straight handpiece has no significance in the conservative part. We have this handpiece. You all have this handpiece. See, this is the handle which holds it. Then this is the shank and this is the head, which is moving like this. So because of this angulation, when you put the burr here, you can reach any part of the tooth and you can do proper cutting. This particular design will bring the burr. The earlier in straight handpiece, the burr was here. Now the burr is here, isn't it? So it is nearer to the handle. The more nearer it is to your hand, it is more easy for you to control it. So the dental burrs, here you can see a burr is a rotary cutting instrument which has bladed cutting head. These are cutting instruments that turn around its own axis to perform work like cutting, abrading, finishing, polishing of the tooth tissue or various restorative material. Look at all the burrs. See, this is the cutting burr. The number of flutes are less. These are abrading points or the diamond points. Here, what is there is that the diamond powder is coated onto the burr tip. Here there are cutting edges. Here it is the diamond powder which is coated on the tip. So these are abrading. These are cutting. Okay. Here you see the burrs. They have multiple flutes or multiple edges. So since they are very closely placed edges, they will only polish the restoration or the tooth. According to the shank design, the classification of the handpiece is straight handpiece shank, latch type, angle shank, or the friction give. I told you the straight handpiece. Here the latching is according to the rotary motion. In your all the micromotors that you are using in the department are having latch type. You move that small latch to hold the burr in place. As you go to the clinical side or the PG, if you do your post graduation and do your clinical work, you will start using air rotor where there is the friction grip type of handpiece. According to the shape of burrs, we have a round burr, we have a straight burr, we have an inverted cone, tapered fissure, and a pear-shaped burr. According to the material of manufacturing, it can be steel or it can be tungsten carbide. According to the size of the burr, this particular size of the burr is given by a manufacturer, and each burr will have a number. You have number 2 round burr, number 4 round burr, number 8 round burr. That is what is told to you, because the size, the size of the head or the diameter of the head is according to these numbers, and these are specific to each manufacturer. So here is what your burr looks like. This is the shank part of your burr. This narrowed part is your neck, and this is your head. Why is this neck narrow? This neck is narrow because if your shank directly goes and hits the head, then it will be very broad here, and your visibility in the cavity will be affected. When this becomes narrow, because its part is only to hold the head. So if this becomes narrow, your visibility increases. Coming to the shank, it fits. This is the shank. I have blocked the other part, so the shank, sorry. So the shank fits into the handpiece and accepts rotary motions. It will accept a rotary motion and provides a bearing for the surface to control the alignment and concentricity of the instrument. Depending upon the type of the handpiece into which the burr fits, there are different shank design. You have a straight handpiece shank, you have a latch type shank, and you have a friction grip. Abhi here, this is a friction grip. You don't see that cut which you see in all your micromotor burr here. It is a straight shank. So this is fitted according to the friction grip. The next is the neck part. I already told you this neck is of no use. It just transmits the rotational and the translation movement to the head. So this neck, if it is narrow, it increases your visibility. And this is the head. This is the most important part of your burr. This is what is available in various sizes, and this is what is going to cut the tooth structure. See here, there are different burrs. All these burrs, see the shank, the handle part is smooth, isn't it? This part is smooth because it is friction grip burr. And here, these are the burrs which you are using in your pre-clinics. There is this latching mechanism present, and these are called as latch type of burrs. Then the shapes, you have round, inverted cone, the pear-shaped burr, the straight fissure burr, and the tapered fissure burr. It's very easy to remember, and I will not go in detail of this. So now is the most difficult part. Have you got that Ravi in your hand? If you have it, it will be easier for you to understand. You have the bladed burrs. The bladed burrs are mainly carbide or the steel burrs. The burr head is made such that it has blades and flutes. See, there is a blade and there is a part which dips inside. That is the flute. Then again there is a blade. Then again there is a dip inside. That is again the flutes. So blades are the elevated portion of projections on the head that are essential for cutting. So this head, the sharp part of the burr, the head, these are only the part which are cutting. Okay, the space provided between the two cutting blades is called as the flute, and this flute is just to collect the debris that is created by cutting off any material, whether the restoration or the tooth surface. So this blade has two faces, one face and another face. When it is moving in whatever direction, your burr will cut only in one direction, that is a clockwise direction. When it moves in a clockwise direction, this part which is in the front is called as the rake face, and the part which is behind is called as the clearance face. Do you understand? So if you hold your hand in a namaste, yeah, the part which is away from you, the edge of the namaste is the cutting edge. If you, on your right side will be the rake face, on your left side will be the clearance face, because you are going to move your hand in a clockwise direction from left to right. Do you understand? Try to hold it in namaste and try to see that, because otherwise you will not understand what I am saying in the next part. So look at this burr. This is a cross section. This is the center part of the burr, and this is the blade part of the burr, that is which is going to cut, and the deeper part of the ye, which is called as a flute. So you have one blade, one flute, another blade, another flute, another blade, flute, blade, flute. So after every blade, there is a dip inside, which is called as the flute. Okay. As we go ahead, I am going to explain all these things to you. What is a rake angle? What is... So coming to the rake angle, it is the angle between the rake face and the radial line. It is most important design characteristic of the burr blade. It may be negative, positive, or zero. So this particular part is taken here and enlarged. So this is the direction of the rotation. So the tip of the blade, the front part I told you is the rake angle. The back part is the clearance angle. This is the flute, isn't it? This is the tip of the blade. So this angle and this particular line is the line which goes to the, if you go back to this picture, the line will come here. So if you draw a line here like this, that is what it means. So this is the line coming from the center of the burr. So the rake angle is from the axis of the burr and the face of the rake angle. So this particular part is called as the rake angle. And this is what is the most important part, because this is the cutting part of the burr. So you have a negative rake angle. A rake angle is said to be negative when the rake face is ahead of the radius or the cutting edge of the axis of the burr. The negative rake angle minimizes the fracture of the cutting edges, thereby increasing the tool life. Now see, this is a negative rake angle. Here what they are saying, this is a rake face and this is the clearance face. This is the tip which is cutting. Okay. This is the center axis. The angle is negative when the rake face is ahead of the axis. What does this mean? This means that this width is more. Agreed? Do you understand? This width is more. That is why anything which is wider will have more strength. And since it has more strength, it will be more efficient in cutting. Okay. Now come to this positive rake angle. When this rake face is, this is the center of the burr. When this rake face is behind your central axis, look at the blade. The blade is thin. After 2 or 3 cutting movements, this blade will break and your cutting will be inefficient because this is very thin. Already your burr is only 1 or 2 mm. In 1 or 2 mm, each cutting blade will be less than 0.5, 0.05 mm, so thin. And if it is further thinner, this will just break within 1 or 2 use. So this is a positive rake angle, this is a negative rake angle. Just like in today's world, when being COVID negative is a positive thing, always remember the rake angle being a negative angle is a positive thing for your cutting. Okay. Till now, we used to find it difficult to remember it, but now with COVID, it is very easy for you to remember that negative is a good sign. Okay, positive is not a good sign. When the rake face trails the radial line, it increases the cutting effectiveness, but disadvantage is that the blade can fracture. Why it is effective in cutting? Because it is very, very sharp, so it can go inside easily, but while coming out it will break. So that is a disadvantage. Here it is very blunt, it is mota, so it will not go inside easily, but once it goes inside, it will not fracture. Or you can have a zero rake angle where the radial line and the rake face are in alignment with each other. Understand? Those of you who had that thing in your hand can understand what is a rake angle, flute, and how it is distinguished. Clearance angle, the angle between the clearance face and work. See, here will be your tooth structure and here the burr will come and hit it. Okay. So this was the rake face. This is the back side of the cutting edge. So this angle is called as the clearance angle. Here what they have done, they have given it one more inclination. They could have taken it straight like this also. But when they take it straight like this, the clearance point is not wide enough for the debris to come out. You've seen, all of you have done cutting, you know that the tooth structure is coming out in powder form. That powder form, when you cut, there has to be some space for it to flow out. Otherwise, your instrument will get jammed into the tooth structure. So this is the clearance angle. And last is the edge angle. The angle which is made by the rake face and the clearance face, the angle in between the two is called as the edge angle. So this edge angle is important because it will tell you how sharp is your burr. I hope you understood this because it's very important. They keep asking you, especially in Viva, what is the rake face, what is the rake angle. So now it is easier. When it is negative, it's a positive sign for you. When it is negative, it is good. Burrs and points. In addition to burrs, for every basic cavity preparation, a whole range of burrs are produced for finishing of preparations and restoration. They can be made of steel or they can be made up of fine diamond points. The difference between the finishing burrs and the cutting burrs are the number of flutes or cutting edges are more in a finishing burr and less in a cutting burr. And here, when you see the abrasives that are that are impregnated on the polishing instruments are very fine and very closely compacted. Coming to the maintenance of your handpieces, any handpiece that you are using is going to get infected because it goes into the patient's mouth, and we all went through the Mahabharat episodes and we saw Shakuni Mama polishing his passes. Why? Because any instrument that you use is your bread and butter in life. If every day you buy a new handpiece, you will have no profit in your clinic. You have to use that one handpiece for 2 years, 3 years, 4 years, 5 years. So unless you maintain that handpiece properly, you will not be able to use it again and again. The first important thing is lubrication. All the enamel powder or denting powder that comes out while cutting the tooth structure gets into the handpiece, the bearings of the handpiece, and it may just become dull and the burr will stop moving. So you have to lubricate it, clean it so that it moves properly. Do not run your handpiece without inserting the burr. This is a very important point because the mechanism is such that if it moves without a burr, it is likely to get damaged. Never drop your handpiece as cartridges may get damaged. The top portion where the bearings are there, if it gets damaged, then your burr will not go into the handpiece. Periodic cleaning of water inlet and outlet to maintain effective coolant. All cutting things, whether you cut in dentistry or you see a knife while sharpening your knife, or whether you see a person doing your tile work, whoever is doing any cutting is always pouring water on it. Even if you rub your hands very harshly on each other, you feel the heat, because any abrasion always generates heat, and this is very less heat. But when you cut at that speed and that cutting capacity, the lot of heat is generated, which might damage the pulp inside the tooth. So we are pouring water on the tooth, and that is how the air rotor can work at 1,50,000 and above speed. The handpieces are sterilized by autoclaving. Now it is becoming mandatory because of this COVID. Earlier in US, earlier they were using disposable handpieces also, but then they are a totally different world, because here the amount we earn in dentistry does not support us to use a disposable handpiece. But things might just change after COVID. You don't. So this is manual lubrication. We have a oil under pressure which we put from the back side of the handpieces, and that flushes out the debris and cleans it. Even automatic handpiece cleaning units are available nowadays where it is cleaned and oiled properly. Then maintenance of your birds. All birds and stones must be autoclaved. Steel birds are degraded because they become very dull and are generally disposed of after every use. The flexible disc and strips also have the same problem. Only tungsten carbide and diamond birds have to be assessed regularly and discarded if they cannot cut properly. Tungsten carbide burrs occasionally break in use, and the diamond burrs become bent. You have seen, all of you have seen these things happening, and that is why taking care of your instrument is the most important thing. Coming to the end of this lecture, all the instruments are there, but it is only your skill which helps you to maintain the instruments and do a proper work. But one must be familiar with the design, how it is handled, and what are its various applications. Dentistry without instruments is not a possibility ever. So get into a habit of learning about your instruments, asking about the cost, because there are so many variety of instruments. Generally we give you a list and you are happy with that, but for every one name we have written, there may be a 10, and then maybe 10, 15 alternatives available which may be more effective for you. So it is more individualistic and more related to what you want to do. So always talk about instrument, always keep seeing. You have net nowadays, so keep checking which instrument is better, how you can use it, because that is the only mantra for a successful dental practice. These are the expected questions. Always you will get one question on this particular topic about armamentarium. So check them out. I wanted you to take pictures, screenshots of your attendance, screenshots of the people, if you can get me, of all the people on one that, and you have to submit your attendance. These are my references.
Yes, ma'am.
Thank you, ma'am.
Yeah, any questions you need to ask?
Thank you, ma'am.
Thank you.
No, ma'am.
One more lecture on armamentarium is remaining. If you feel that you need any help for anything, you let me know. I will ask them to give you the details. Okay. How many of you have attended today?
68
66.
and
Is this
68.
helpful? Is this helpful for you? I don't know. Is this helpful for you?
Yes, ma'am.
Yes, ma'am.
So, anything else?
Yes.
Anything else you would want us to add for ye? Add on these topics, because these are very important topics and you need to know about them in detail. Okay. If you have any difficulty, you can approach any staff, any student, PG student in the department, and they'll help you out. Or you can put the answers on the questions on the group calls. Okay. Shall we then? I'll see you.
Yes, ma'am.
Okay. Bye bye. Take care.
Thank you, ma'am.
Okay,
Thank
ma'am.
you, ma'am.
Thank you, ma'am.
Take care. Be safe. Don't move around. Okay.
Yes, ma'am.
Yes, ma'am.
Okay. See you.